So psychosocial interventions are mental health, psychological and social interventions aimed for people who are using drugs to be able to improve their general well-being. The aim of this is to be able to address factors that could have led to the drug use, to be able to teach this patient coping skills, and then the major one is to reintegrate this patient back to society as they continue with their recovery. The staff that were involved were medical social workers, addiction counselors. We also had a clinical officer of psychiatry, and we also had a psychiatrist, a psychologist, and myself as the mental health supervisor. What also happens is that we'll also have multidisciplinary team meetings where we discuss the progress of a patient, and there's a representation from every department. When a patient is coming into the clinic, they'll be linked to a primary social worker, a primary addiction counselor, and then they'll undergo a baseline mental status exam. This is for us to be able to understand if there are any underlying reasons that led to the addiction. The patient is also seen by other service providers. So during the pairing for the mental health and psychosocial services, the other key person in the cohort, other than the social worker, the addiction counselor, is a community health worker. They'll also be knowledgeable of the treatment goals that this patient has, and they'll be able to help the patient actualize some of those goals. And then the community health worker will also help in terms of tracing the patient. If they have any prior history of mental illness, or if this drug use actually contributed to a current mental illness. So what happens is that when the patient has that core team, then they work together with the patient to come up with the treatment plan that they'll walk the journey with together with the patient. The social worker will be able to have interventions based on the assessment that they were able to do. So as part of social work, some of the assessments they're able to do is, does this person have food security? Are we able to link them with the family if they have good family relations to support them in terms of their nutritional needs? If they've had a history of crime, or they have been engaged with the law enforcement, how are they able to link them up with a probation officer? And the probation officer will now be able to advocate for first-time offenders, or what we call petty offenders, to have non-custodial sentences. Then the social worker will also link them to the area chief for the patients who have never acquired a national identity card to do so. And this is important because now we can be able to enroll them into what we call NHIF, which is the National Hospital Insurance Fund, for them to be able to access services that we're not able to offer in the facility in terms of tertiary and secondary care. The social worker now will also be able to work on skills assessment for the patient. So once the social worker has completed the assessment, then they'll take the file to the primary addiction counselor for this patient, and then now in terms of the assessment, they'll be able to look at what we call advanced childhood experiences that could have led to drug use in terms of trauma, after which they'll be able to have interventions for that assessment.
At the clinic you get a lot of support, especially from the peer educators. You get support from the counselor a lot, especially the counselor, because you get to tell your counselor about the intimate details about your mental health. And also from the doctors really help a lot. They tell you about the type of food you're supposed to eat so that you can have a healthy body, the type of exercises you're supposed to be doing.
So once the addiction counselor is done, then they'll be able to link the patient to different group therapies available in the clinic. So the group therapies will be determined by the phase of treatment the patient is in. They're able to learn about the changes they'll experience, some of the side effects they may face with the drug, and how they're able to deal with the triggers in the initial phases. After which, then we'll have other available group therapies for them. We've had a couples therapy group. We've had what we call a family therapy group. This is for the treatment supporters for the patients in treatment. It could be a parent, it could be a sibling who's supportive, it could be a spouse, or it could be a friend who's supportive of their treatment. This is important because addiction does not only affect the individual, it will affect the people who the individual lives with, who the individual interacts with, and it will also affect how productive that person is in the community. Some of the activities that we have is that we have recreational activities, we have pool, we have weightlifting activities. Then it also acts as the main training area for patients. Once they've gone through a skills assessment with a social worker, we'll be able to plan for trainings for them, and that's where they'll be going for the trainings. And often the trainings are group trainings. Beyond the MAT clinics, the social worker will take turns for patients who have been incarcerated to be able to do prison visits to ensure that we continue with their psychosocial management, care and treatment. We'll also be able to do what we call community sensitizations. This includes having social workers reach out to other what we call MAT actors in the community for services we don't offer. For example, if we assess a patient and they say they are homeless and they don't have support, are we able to link them up to a shelter as they try to get back on their feet? Then we'll also be able to do what we call family home visits, which will be done together with an addiction counselor, a social worker, a nutritionist, and sometimes even a clinician, where they go with the consent of the patient, they go to the home of this person to explain about addiction to the family members for them to be able to support this person into treatment. And this is important because we've said sometimes family members might actually kick someone out of the family household because they are using drugs. Then the social workers will also be able to do letters for patients who've been arrested, so that whichever police station they're at, this patient will still have access to their treatment, where the police officer will bring them for their treatment as they continue to undergo their court cases. So reintegration now will also stem further down to the community, where we'll join the chief when they have their barazas to talk about addiction and how we are link these people and refer them to the MAT clinic. This is important because people who are using drugs are often stigmatized and discriminated because of lack of knowledge most often. So it's very key to involve the community and the family members at every stage of treatment. So if they have jobs in the community, instead of them giving them to other people, are they able to offer chances on people who use drugs and give them these opportunities that they're able to earn an income. Once they're in the clinic, they'll also be able to do assessments for other mental illness, and then based on the outcome of that mental status exam, they'll have a treatment plan for this patient. So for the patient, for it to be synchronized, what will happen is that the addiction counselor can actually sit in the sessions with the clinical officer or psychiatrist, and they come up with one treatment goal for the patient. So if at baseline the mental status exam is normal, then we'll review this patient again after 1 month and then continuously do so after every 3 months.